How do I treat my loose and crepey lower eyelid skin?
Loose and crepey skin under the eyes inspires people to buy creams and apply all kinds of remedies in order to restore the skin to a more youthful appearance. Patients come in to see me and show me how much better their eyelid skin looks when they push their lower eyelids upward and outward. Sometimes they pull on the skin and ask me if I can remove the skin so the skin will appear tighter. In actual practice, the surgical removal of lower eyelid skin can lead to complications, such as the rounding or retraction of the lower eyelids. There are times when a skin shortage also will lead to ectropion, where the lower eyelid everts outward. The lower eyelid margin is very easily displaced, so preserving the integrity of the delicate supporting structures is vital. My perspective on loose and crepey skin that it's mostly a skin quality issue, not a skin quantity issue. Skin quality under the eyes is affected by aging as well as lifestyle. Collagen, which is the protein critical to the foundation of the skin, called the dermis, diminishes by 1% every year from the age of 25. This loss is compounded by processes that break down collagen, such as smoking and excessive sun exposure. This is particularly significant for the under eye area, since the eyelid skin is less than 0.5 millimeter in thickness. In my practice, I approach lower eyelid crepey skin by focusing on the improving skin quality in the dermis through the stimulation of collagen production. I approach the outer aspect of the skin, or the epidermis, by focusing on color and texture. In modern life, anyone with internet access researching treatments for crepey skin are bombarded by ads and biased-driven content by slick medical retailers driven by transactions and not interested in the long-term consequences of their products or procedures. Consumers are also subjected to marketing of devices which may have initially appeared to hold promise, but in actuality are not very effective. This is common for companies that sell the devices and the medical retailers who still have lease payments to make. In my practice, I help patients with crepey skin with lasers, radiofrequency, and regenerative technology, such as PRP, or platelet-rich plasma, and PRF, or platelet-rich fibrin matrix. I use lasers which I own outright because I have confidence in their utility to help my patients for years to come. This contrasts with the hype-driven marketing of devices with catchy names that become obsolete in short time, so the companies can make more money with the, quote, updated version of the device, which didn't quite deliver what they claimed to initially. It's interesting how they don't acknowledge that their previous devices were deceptively marketed. I perform procedures such as fractional CO2 laser, fractional erbium laser, and long-pulsed non-ablative erbium laser to treat crepey eyelid skin. I like to enhance and optimize these treatments when indicated with PRP or PRF. PRP or PRF is a concentration of the factors produced in response to injury from your blood to stimulate collagen production and new blood vessels. The results can be fairly significant with only one session. At the same time, I look at the patient's lifestyle and discuss some options for optimizing and maintaining results. This may involve PRP or PRF injections, as well as non-ablative long-pulsed erbium laser called smooth eye. For patients with darker skin, I'll use radiofrequency technology as a laser alternative, as well as PRP and PRF. There is a common misperception that more aggressive injury to your skin results in better collagen stimulation. This is not true. Your skin has a limited capacity to produce collagen, and this is where the practitioner's judgment is critical. I'm often seeing people who had aggressive microneedling or multiple types of lasers and radiofrequency microneedling sessions. Oftentimes, the patient feels like they don't see any improvement, and at times, their skin actually becomes thinner. There are many options for improving skin quality for crepey lower eyelid skin. In my experience, it's important to be conservative and protect the skin's integrity by selecting the appropriate laser, radiofrequency device, and regenerative technology. I follow my patients for months and years afterwards and provide ongoing guidance. I hope you found this information from my experience helpful. If you are interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.